Welcome to the Plant-Free MD podcast with Dr. Anthony Chaffee, where we discuss diet and nutrition and how this affects health and chronic disease, and show you how you can use this to optimize your health and happiness, both mentally and physically. Hello, everyone. Thank you for joining me for another episode of the Plant-Free MD podcast. I'm your host, Dr. Anthony Chaffee, and today I have a very special guest, Rebekah Bavry, who is going to tell us her story. Becca, thank you so much for coming on. It's great to see you.
Great to see you too. Thanks for having me.
Very, very welcome. So for people who don't know you and your involvement in healing humanity and other sorts of things, like Dr. Barry's network as well, can you tell us a bit about yourself and what you do?
I'm an Army wife and mom to two autistic twins. I'm also a nurse and have a host of certifications for Primal Health Coach and then a Certified Ketogenic Nutrition Specialist. So I volunteer for Dr. Barry and his group as an essentials coach, and then I volunteer with Healing Humanity, and I've been on a ketogenic journey since 2018, and I did it for autoimmune reasons. Um, Weird story. My brother kind of gave me the idea to do keto back in 2018, and I have two autoimmune diseases, Hashimoto's and Sjogren's, and they're not really treatable other than hormone replacement and symptom management. And I was sick and tired of being sick and tired. It was hard to get up out of bed. My husband kept having to ask me to get up and you got to get up and take care of the kids, and you got to get them off to school. I have to go to work because he's Army. He's got a schedule he has to stick to. And he was doing my job and his too. And my brother suggested this. I looked into it, kind of jumped in to sort of a dirty Atkins keto type thing. And it really did just start to help. And I cleaned it up more and it was able to get off my medication. So I was on antidepressants. I was on pain management on narcotics. I was on gabapentin for peripheral neuropathy and blood pressure medications and anti-anxiety meds and just so many things. And when I was able to get off these medications, I started digging into the science, and there was some back in 2018, and decided to get certified in 2019, and it just kind of snowballed to where I am now. And with that, it was back in 2023 that I asked Dr. Barry if I should go back and become a provider so that I could become a low carb provider. And he was like, hell yeah. Just keep your head down, get the grades, get your certification, then do whatever you want when you get out. Which is only partially true for nurse practitioners because there's a lot of rules and regs for us. But, so now I should graduate sometime next year.
Very good. And so what's the plan then?
That is a really great question. So we're
excellent question. I have no idea.
I know. Well, okay, so we're military. You heard me say that. We are actually moving again this summer to Fort Campbell, Kentucky. And it depends on how long we're there and if we decide to stay there or if we retire someplace else. So it could be that I open my own practice depending on the state, or it could be that I try to join a concierge service. You got Rivero out there, you've got Dr. Tro's services out there. And I think we're going to start seeing more and more of those pop up. But the goal is to specialize in metabolic health and endocrine health because super fascinated with the thyroid.
Yeah, very good. All right. And so we were talking about this a bit off camera, but we're talking about how it can be a bit of a difficult issue coming into this, especially as a practitioner, you're sort of bucking trends and things like that, and you can get weird looks from your colleagues or even flat out opposition, and but going through it as getting your certifications, that can have a lot of issues as well because now you're being taught things and you're like, no, bullshit, and
Yeah.
so how's that been for you?
Yeah. Oh, it's been well, the I've learned that the books are basically bought and paid for. All of our textbooks are bought and paid for by the ADA, the AHA, and the AMA. And
Mm,
it's their recommendations, whatever they say goes. And that still holds for even some things as simple as thyroid health. Even with management of thyroid, they tell you that you just need to check a TSH. And it's like even the endocrine society doesn't even say that anymore, but
mm.
that's what's still in the books, and that's what they tell people. And interesting, telling people that 7% is great for a hemoglobin A1C is it's really sad when we know that we have studies proven that 5.7 is when the damage starts. And it's just you have to put those book answers, because I'm not going to give up a 4.0 right now. Um, I'm not giving it up for to miss a question. Um, but you're cursing in your head the whole time. Like, and our exams are proctored, not like in medical school where you're actually in person. A lot of our stuff's online. So our exams are proctored, and so you can't say anything. So if I was cursing the camera, then I'd lose all my exam grades.
Yeah. Yeah, so that would be good. Um, that's a funny thing too, is they say, well, go by the recommendations of these organizations.
Mhm.
They're private organizations. I mean, these are just people that just decided to come together and just say, hey, why don't we make an organization? There's enough people with diabetes now. And then they're just making recommendations. Potentially, hopefully, maybe originally because they want to help people. And so they want to
Yeah.
get a standardized set of treatments that they think are the best. But it's been completely corrupted by the food and drug companies. I mean, you have like Coca-Cola and Nestle and these sorts of things. I believe are still sponsors of the American Diabetics Association,
I
and
think so.
yeah, I think so too. Or at least processed food in general does that. And I know that historically, I mean, even going on like the weird little vegan shows like that horrible propaganda piece, the what the health thing that went on Netflix years ago. They went after a guy who was like high up in the ADA, and he was and they even talked about how like Nestle and Coke, they were all sponsoring them and all that sort of nonsense. But these are private organizations, just like the American Heart Association, and people put so much credence in that. It's just some private group's
Group of
opinion. I mean,
people.
those,
Yeah.
yeah,
And it's amazing how they've affected public policy so much. Of course, it's getting into politics, but money lines pockets,
yeah.
and they've lobbied so much, and it's absolutely astounding. I mean, I don't know if you know about the American Medical Association and their lobbying against nurse practitioners and PAs. Did you know that?
No, no, it didn't. No.
There's ongoing lobbying. They spend millions of dollars lobbying Congress to try to get nurse practitioners and PAs to pull their scope of practice all the way back to where they can't even do prescriptive authority. Like,
Yeah. Milton Friedman talked about that. You know who Milton Friedman is? He's
I don't.
he's a Nobel Prize winning economist. He was a friend and mentor and then colleague of one of my heroes, Thomas Sowell, and Milton Friedman is definitely a hero as well. But he's been talking about that, the medical guild. It's just like this exclusive club
Mhm.
that's great to be in, but but
They don't want anybody else in it.
that's it. They want to keep it exclusive, right?
Well,
So they don't
and
they don't want they don't want competition. You keeps their wages high, keeps them in demand, all that sort of stuff,
well,
which he thought was a really bad idea, and I agree.
I mean, even like my brother's a PA,
Hmm.
and he's actually a physician's assistant first assist. He's one of the last ones in the country that still has just a bachelor's degree, and he
Oh
does
wow,
open heart surgeries from start to finish. He is one of
yeah,
the
wow.
only ones that can and have done it themselves,
Hmm.
cracking the chest, harvesting the veins, you know, and people want to limit his scope of
Yeah,
practice. And it's like he he trains all the new people and nobody can hack it. So
Mm.
it's like,
Yeah.
experience does trump some things. I mean, but I agree. I
Yeah.
do agree that nurse practitioners need more hours, but
Mm.
that's a whole other that's a whole other
Mm.
conversation. I'm so
Yeah.
against the grain on that one.
Yeah. Did they or would they grandfather in people that are already there? Like your brother already has experience in that, he's already doing that. Would they say, no, you're not allowed to do that anymore?
No, they want to pull it back for
Yeah, right.
everybody. Yeah. So like every nurse
Stupid.
practitioner in every state, like they want to pull it back. It's the AMA. But
Mm.
I mean,
Yeah,
it never passes and Congress always
good.
like shelves it. But yeah, that's
Yeah.
what they try to do.
Yeah, well, that's absurd. I mean, if there's an actual reason, like people were getting hurt, and that's one thing. But the AMA would be able to pick those people out. Like, hey, you're hurting people. We're deregistering you.
Well,
You know?
there are more nurse practitioners being sued for, you know,
Okay.
along with the physicians that oversee them,
Hmm.
but it's not anything more than than actual physicians being sued, so it's still on par.
Yeah, and
So,
it's like it has to be taken on an individual basis, right? I mean, there's people that
yeah.
like your brother is doing freaking open heart surgery and like doing like all this great work. Why would you limit his scope of practice if he's never had an issue, if he's never had a complaint, if he's never had, malpractice, suit or something like that? Why would you? So doing that blanket across the board that we just assume that everybody's incompetent doesn't really make
Money.
sense. Yeah, I believe it. And it's you know, sort of going, well, yeah, it's just sort of keeping that exclusive club and things like that. It's like a guild, sort of thing. But Milton Friedman makes a lot of really good arguments for it and shows how that has impacted, health in around the world and access to healthcare and things like that. It did not used to be like that. I mean, back in the early 1900s and before the Flexner Report, you could just be a doctor. You could just have apprentices. You can just train doctors, and it was just like basically going. You're saying like, yeah, this guy's good enough, and they would just send a letter in, and they would get licensed. And there were universities, and there were other training programs, but there were all sorts of different things, and then the undergraduate medical degrees, etc. Um, there are a lot of different pathways. Johns Hopkins was the only one that was postgraduate, high academic rigor, and all that sort of stuff. And they also had some brilliant professors like Dr. Osler and things like that. William Osler, who was thought to be the greatest medical educator in history. But the Flexner Report, Carnegie, people always get this wrong. They always say that Rockefeller put the Flexner Report out, and it was in order to, well, you don't know his motivations, but it wasn't Rockefeller anyway. It was actually Carnegie.
Carnegie.
So Carnegie did it, and I took a class on this actually on medical history from a it was a course at Yale. You just did it on just for fun online. But we addressed this specifically, and you can look it up. It's on Wikipedia. It's like Carnegie, right? And so Carnegie did this, and the purpose of it, stated purpose, was to see who trains the best doctors, right? And what system is it? And Flexner found that Johns Hopkins was far and away making training the best doctors back in the 20s or something like that. And was it their system? Was it because they had the most brilliant professors? Who knows? But that's what he found. He said, these are the guys making the best doctors. And so Carnegie said, okay, anybody who wants to adopt this way of doing it, here's $50 million in a fund, which is like billions now. That was
Yeah.
back in the 20s. And so people just jumped on it because they just wanted money. They're like, great, yeah, we'll do that. Fine. We'll build new wings and new thises and that's, and we'll just adopt your system. Fine, no problem. And so that's why that changed for us. It actually is changing around the world. But before that, you had a lot more doctors and you had a lot more ways of training doctors. And now it's a much more exclusive club. And Milton Friedman talked a lot about that. I think he would have had a field day for how corrupt the medical system is now if he was still around. But like
Well,
saying that, recommending that, like, oh, you should listen to the Diabetics Association recommendation, or you should listen to the American Heart Association. These are private entities that just have their own personal opinion. I mean, that's like saying we should follow the Bill and Melinda Gates Foundation recommendations for vaccines and all these other. they're not actually someone
Don't get me
who
started.
is necessarily an authority and should be. This is a
Or
private
should be.
organization and
Or
they have
should be.
or should be. No,
No,
no, absolutely not. So, that's it is, we
it's
think of these things like the AHA and the ADA and the AMA as like, well, these are the authoritative bodies. Like, no,
yeah.
they're just like five guys who just decided to make a club. And now they've got it's just a big club now,
The
you
good
know?
old boys club. Yeah.
Yeah.
I mean, even medicine has changed so much. So, like, my whole family was medicine, except for
Mhm.
my one brother is an analytical chemist. So he didn't go the way of medicine. He went chemistry. Um, but my mom was an OR nurse
Mhm.
and my dad was a DO. And
Mhm.
when my dad actually graduated in 1981, right after I was born. And he didn't even do a residency. Like, they didn't have to do residencies for family practice. Like, it was just, oh, I'm just going to get out of med school and go do it. And that's what he did. And it's interesting how now it's like a mandatory 3-year
Mhm.
residency. Like, you can't skip it. And it's changed a lot even since then.
Yeah. And yeah, definitely. So what are some of the things that you've come across where you just have to really like bite your tongue, that like to be wrong and but they're saying something ridiculous?
Diabetes is definitely the number one. Like, and then now we're on the fringe. So when they talk about bad cholesterol, I hate the term bad cholesterol, um, because it's not bad. Like,
Yeah.
guys, we need it. I think that it's so counterintuitive, when you think about the recommendations these days and lowering cholesterol. It grates on my nerves because I'm like, we physiologically know why we need it, yet we're over here messing with the liver, telling it to stop. And I'm like, where does that, like, where did anybody playing God ever go well? Ever in our universe? It never has. So when you see the recommendations, now I will say in my patho book, I love pathophysiology. I'm a nerd, complete nerd. I found it fascinating. Yes, it was hard, but I loved every minute of it. And our book actually does not recommend statins immediately, which is interesting. It recommends CAC scores. Oh, they have high cholesterol? Send them. Send them. It's like immediately send them for a CAC and then consider. Send them and consider. And I was like, no, see, that's a good recommendation. Let's do that. But then in the text, it's like LDL cholesterol is bad. And it's like, oh, like, and I love, did you see the cholesterol code? Dave Feldman's new, he's got a new documentary.
Okay. Yeah. Oh
Okay,
no, no,
so
I think I've seen it.
okay, so it just debuted. No, he said it's not considered a premiere. It was a early showing. Okay. So it was at COSI
Okay.
and they were able to show it. And it's about his study and the results of the study. And that is about to come out, I think, and is going to be on a streaming platform sometime. But I think we're going to turn things on their heads. And
Awesome.
and
My
I hope
God.
so.
Yeah. Yeah.
I hope so. I will say, dealing with people who are so still entrenched, at my previous school, one of my people, I was like, I will never prescribe a statin. Like, my goal is to deprescribe medications and I will not do the things. And he was like, well, then you'll lose your license.
Hmm.
And I'm like, why? Because I didn't hurt a patient? Like, making medical judgment, we have studies, evidence-based practice. We're supposed to do this and use evidence-based practice and use critical thinking skills. And you're telling me that somebody's going to take my license because I can make a really good argument for not using it? And he's like, yeah, that's your license. And I'm like, good God. Like,
I don't know about that. I mean, the thing is that if it's evidence based and you can make it and you can defend your position, you may get attacked. And when you sort of
Yeah.
step outside of that, you may get attacked. You may have
Oh
people
yeah.
saying, "Well, what the hell?" And then you have to defend yourself. You say, "No, this I'm following the evidence. This is evidence based. Evidence changes. These are the guidelines. Guidelines are there to help people that are very new and that don't have a direction to go on. So, okay, well, just go in this direction." And then when you learn more about it and you get more, adept and familiar with the literature, then you get to make your own decisions based on your clinical judgment. And additionally, if no one's having a bad result, then you
Yeah.
can't really say that there's any harm being done because no harm's been done. And you say, listen, I've been finding very good, positive, health outcomes doing this. And this is benefiting my patients more than that. When I did this other thing, I didn't get as good of results. So that's why I do this, and it's supported by the literature. That's why I changed, because it's supported by the literature, it's evidence-based, and I get better results. It would be immoral and malpractice if I didn't do that,
It,
because yeah.
yeah. So it's interesting what you come up against. I mean, there's other things that I won't mention, but that are they're too political, and I'll just keep my mouth shut until I graduate.
Hey everyone, really happy to announce a new sponsor for the show and for everybody down in Australia, Stockman Steaks, who are delivering high quality grass fed and finished pasture raised beef and other meats, flash frozen and vacuum sealed to your door, something that I've been enjoying a lot of myself recently as well. They also have a great range of specialty items such as high fat keto mince and carnivore beef and organs mince with liver, kidneys, and beef heart as well. So use code Chaffee today for a free order of beef mince or another specialty gift along with your order at stockmansteaks.com.au, and I'll see you over there. Thanks, guys. That's that's fine. Yeah, well, it's good for you for going back and sort of wading through that. It is a lot easier to go through when you're just bright-eyed and bushy-tailed and like, oh, I'm just so happy to learn all this stuff. When you're coming through, jaded and cynical, and you've already seen, the corruption and
Yeah.
corrosion in the field and the world, and you're just like, oh, this is bullshit. You people are just, but we know it's true, and so
Yeah.
we just need to, yeah, you
And
say the
it's
answer that they want to hear, and then
and get it
do
and
what you
get the
want. Yeah,
grades.
then do the right thing as a
Yeah.
practitioner.
Yeah. So I am excited about like the American Diabetes Society that Dr. Barry started. And I'm hoping that somebody comes up with an American Heart Society or something to rival, because that would be great.
Yeah,
And we just need people to sit down and start writing the textbooks in the way that they need to go. I mean, we have the ketogenic textbook, and I have it from Tim Noakes's foundation, and it's brilliant. But we need mainstream textbooks that are written by people who actually don't have a monetary stake in keeping people sick.
yeah,
That'd be
yeah,
great.
definitely. And I like the Dr. Barry's diabetes group, because they explicitly say we're not taking money from any of these people that would be a conflict in treatment, and ranchers, sure, but no drug companies or anything like
No
that,
sugar companies.
or sugar
Like
companies. Yeah,
the
it's not
American
ridiculous.
Diabetes,
Yeah,
oh my gosh, their recipes drive me nuts. Like
yeah.
it's like here, do a cucumber salad, put a quarter cup of sugar in it.
I
What
saw
the
that.
hell?
Yeah, what is that? Quarter cup of sugar for a
In
diabetic.
in a cucumber salad. Wow, like
Yeah, yeah. Do
I
you,
like
does cucumber
I
really
like
need
cucumber
sugar?
salad. Like why would you need sugar in it? Like why would you want it sweet? Like okay, so now I'm a little bit jaded because I have gone so long without sugar that everything tastes really sweet to me. I'm sorry, this cat is shedding all over me. It's like flying in the air. Um sorry. Um but everything tastes super sweet to me. So I don't know why anybody would want to add extra to
Yeah. Yeah,
anything.
well,
So
and also the diabetes thing. I guess they're true to their name. Actually, made a bit of a story or post on that when I saw that, and I said, well, Diabetes Association is true to their name, giving you recommendations and recipes to give you diabetes, and that's what they're
oh, well,
trying to do.
connected for life. That's their
Yeah,
connected for life. My goal is for people not to need me.
yeah,
I want
yeah,
people to not need me. Like, why did this okay, this is so probably a stupid question. When did it start that we had to start going to the doctor every year? It
Yeah.
used to be that you went to the doctor only when you were sick or you
Mm,
had them make house calls.
mhm.
So why do we have yearly visits for every child? Why do we have yearly visits for every human being? Like why? Like when did that guideline change?
I sort of remember it happening
Mm,
probably in the 80s and 90s. I mean, it's just that you just sort of had, I remember as a kid, it was just sort of, oh, you should get an annual checkup, and you should just get in there. And I mean, now it's just sort of an annual checkup is, I guess there's the argument was for the preventative side of things, which is to make
mhm.
sure that people aren't going off the rails, which is, fair enough. But maybe it's trying to drum up more office visits. But now at this point, I mean, you don't even need an annual visit because
You're
they're in
there all
there
the time.
5 times a month to like try to sort all these problems out.
Well, I'm still doing that with my thyroid, so I can't say anything. Although my nurse practitioner she's like, "Get your labs." Oh, and I'll see you in 12 weeks. It's- yeah. And I'm like, "My thyroid tanked." And you're
Mm,
like,
yeah, see
12
you in 3 months.
weeks?
Yeah, yeah.
Yeah. I'm
Just
like,
deal with it.
"Okay, own your labs. I'll just do that. Let me see. Let's see. What's the standard of care? 30 milligrams per week is what you need to go up. That's the endocrine standard. I guess I'll be dosing myself. Great. Thanks. Thanks, ma'am, for helping me.
Yeah,
Think that's where I'm at right now. So
yeah. Well, yeah,
it's so not safe. Don't do that. Don't do
no,
what I'm doing.
yeah, don't self-prescribe. Definitely
No,
don't do that. Yeah.
don't do that.
Like, it's very, very important. Yeah, I don't know exactly when they started doing that, but um, our need to go to the doctor has certainly changed.
Yeah.
And certainly, going to the doctor when you need to was what you did historically, but also that was much more rare. You didn't need to go to
It
the
was.
doctor
Yeah.
nearly as much. Now people are going to the doctor all the time, and you just constantly have to go in and get more medications and this is and that. And that's definitely spiked in the last 40 years. And it's just, really started to come up and then just kept going up. It hasn't slowed down.
It
And,
hasn't stopped. Yeah.
we're the most technologically advanced that we've ever been. And yet we're the sickest we've ever been. And we have highest disease prevalence that we've ever had. And life expectancies are coming down and it's not up and all these other
Yeah.
sorts of things. So obviously it's not working. You can have all the technology in the world, but that doesn't mean you're doing the right thing.
Well, sometimes having technology and using it, sometimes it's just because you have it doesn't mean you should use it. I
Mhm.
think in a lot of situations. Um, I was talking to Carrie Mann and he was like, "Hey, you need to talk about this." So, and I think it'll kind of it's a good segue. Um, so what do you think is causing it? I have two autistic teenagers. They are 17, two different brands of autism, and they're twins, boy and a girl, and both are autistic. And I have my suspicions. And then whenever you interviewed somebody from MIT and it just kind of exploded my mind. And I just want to see if you think it's the same thing that I think it is that's causing autism in our society.
I think it's probably going to be multiple reasons, but I definitely think that that diet has a big role to play in that. When these other chronic diseases started spiking up, I looked at it and autism
Autism.
started going up at the exact
Mhm.
same time.
Yep.
And people saying, well, it's just a diagnostic issue. We're better at
That's a
no.
bunch
I
of
mean,
bullshit. I don't even
total
like,
bullshit. Yeah.
yeah.
Well, I mean, that's just someone who's never had a family member who had autism
Yeah.
or ever seen anybody with autism. And I mean, that's not something you miss. Some can be very mild and some can be
Mhm.
extremely severe. And so of people with cases with severe autism, there are much, much, much more cases now. It's much more prevalent.
Mhm.
We're not talking about someone who's just a bit weird at social events. We're talking about someone who has a profound learning disability
Yeah.
and can't function under normal circumstances. That has increased dramatically. So you can't just chalk that up to Well, we just didn't notice it. You can say that once and only once. And they said that in the 90s when it started going up. Oh, it's just we're just getting better at
Mhm.
detecting it and all blah 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 blah. Or maybe we're diagnosing something else, calling it something else, but now we're calling it autism. Okay, you can say that once. Now you're paying attention. So why did it go up in 2000s? And why did it go up again in the 2010s and the 2020s?
Yep.
A really good way of looking at it is one that RFK mentioned, which was kids now,
Mhm.
the autism rate is 1 in 34 Americans and 1 in 22 males, right? In this upcoming generation. And
It was
that
1 in 130 when mine were diagnosed for
there you go.
males. 1 in 130 for males.
There you go. So that's already gone up by multiples. But people alive right now who are in their 70s, the autism rate is 1 in 10,000. So, if in the 70s people weren't diagnosing this properly, that's one thing. But those same people are now adults who could then be, get a proper diagnosis because now we know. And I know people who have gotten an autism diagnosis in their 40s, said,
Yeah.
hey, look, we think you have, some autism spectrum sort of things. And they're fully functional, they have
Well,
family and kids and all that sort of stuff.
there's
But
one that we both
autism.
know and have both been on their channel before.
Mhm.
And Bart, like Bart
Yeah.
K is high functioning. And, you know, it's pretty interesting. And I really appreciated your video on with the woman from MIT. I need to read her book. I just don't have time right now. I just
Mhm.
don't have time. But it makes so much sense when you look at it. There was a reel that somebody posted on Instagram, and I cannot tell you who did it, but it was showing the pounds of glyphosate that was used since like a certain amount. It was like a ticker that had
Yeah.
a bar graph and it just kept ticking. And it was right in the early 2000s that glyphosate hit like number 2. And I think about like the ketogenic book that has some studies in it, the ketogenic textbook, and it says that non-breastfed babies were more likely to have autism.
Mhm.
So it was like, okay, so why is that? And if you look at babies that are born or fed formula, these formulas, what do they have in it? And I'm like, how much of them contain glyphosate? How
Yep.
much do they how much do they contain?
Mhm.
And it doesn't even have the proper nutrition in it for their brain development. And I remember my kids from okay, number 1, I was strep B positive, so they gave both of them antibiotics at birth, like IV antibiotics at birth. So their gut microbiome was completely destroyed from the moment that they entered into the world. I didn't breastfeed because I didn't make anything. I made nothing. So we had to bottle feed and no formula worked. My son projectile vomited everything we put, everything, absolutely everything. And my daughter's, like, she was constipated from the time she was on formula. And it's like their gut microbiomes were completely destroyed from birth. And so there are a lot of people that like to slam vaccines and stuff, and I'm like, guys, I think you're missing the forest for the trees, and it's not just one thing; it's the whole immune system. Do I think vaccines, like giving them 50,000 shots? Yes, I think that there's a problem with that. But I think we're destroying their guts from the beginning. You're giving them these little puffs cereals when they can first start to teeth. And what's it made with? Oh, wait, it's made of like oats and stuff that has like a huge glyphosate load. Great. Like, let's just
Thousands of times the levels that are considered
safe,
safe or
safe.
acceptable. That's been shown in
Yeah.
multiple studies.
Well, and if you look at what it's actually classified as, it's not classified as a pesticide or an herbicide. It's a freaking antibiotic. It's
Mm-hmm.
not even like we are literally microdosing everybody with antibiotics and it's destroying our gut microbiome. And I think that once that happens, that's where the immune system starts. You're going to start effing with the brain and then it all goes to shit from there.
Yeah, I think that's Yeah, I really liked Dr. Seneff's
Mhm.
work. I love her work on glyphosate and deuterium. Everything that lady does is brilliant. But glyphosate, she's really been railing at this for years and years and years. And you look at when this came in to the food supply was in 1993, and then you did see a massive spike at that time. And I think that it's probably a lot of things. And I would guess that glyphosate is probably a major contributor to that. Now it's we use 4.5 billion gallons of glyphosate a year. It's just absolutely dumping it. And like 90, there was some statistic, it was like over 99% never touches a weed. It's just used to like, ripen crops. And then a lot of this just gets washed off. It gets into the water
Into the
supply,
water
gets in the,
system.
yeah, and
Yeah.
destroys the microbiome in the soil. It destroys soil health, gets in the water. It's now in the rain. It's just, and we're just using more and more and more of it. Um, and that is just absolutely going to be just an ecological disaster. When we're talking about like cows in a field and how they're destroying the planet, and it's just like really not the 4.5 billion gallons of glyphosate that's
Of
dumping
glyphosate. Yeah.
that is known to destroy life, you
Yeah.
know, plant life, bacterial life, potentially, damaging human life, and we're just ignoring that, and it's absolutely wild. But when you're selling 4.5 billion gallons of glyphosate a year, you've got a pretty large marketing budget. You can
I have
cover all that up.
I have I hate Monsanto, and I will always
Hmm.
hate Monsanto because my dad was in Vietnam and he was sprayed
Mm.
with Agent Orange.
Okay.
So yeah, so like when I say like we're probably partially it could be genetic with me. Like I might have passed on something because my dad was literally oil slicked. He's like, it was just running down us, like, because they got sprayed directly with it. And so it's like, yeah, his DNA was probably screwed up. So mine's probably screwed up, and I've passed it on to my kids. Fantastic. But, we've already told our kids get genetic testing before you have kids if they want kids. My daughter says she doesn't, but,
Yeah.
we'll see what happens. But it's like, it should be criminal.
Yeah, well, it was really interesting. What Dr. Senf was saying was that when I mean this is why you need to actually have bring back like actual um, science with integrity, because
Mhm.
it used to be if it wasn't replicable, you didn't even pay attention to it, and you certainly didn't change policy over it. And so if you had one lab say, "Oh, hey, look at this, we found this," it's like, okay, that's cute and all, but it wouldn't even get considered for publication unless it was reproducible, unless there's someone else reproduced it. This was a big thing with homeopathic medicine.
Mhm.
It was actually a big homeopathic proponent, and he did this study showing, look at this, it has all these benefits from homeopathy. And homeopathy, true homeopathy, is you dilute some offending substance so low that statistically there is a one, I forget the exact numbers, but it's something like 1 × 10 to the negative 34th power, like chance to one that you'll have one molecule of the original substance left, right? So there's basically no chance in hell that there's even one molecule left, right?
Left.
And so they're saying that the magic of the impression that is left on the water is what's going to heal you. And it's like, okay, well, that's a theory. Let's test it. And so he put this study out that, well, he did it, right? And said, well, you have to do it in this special way and all that sort of stuff. And so they put it out, and it showed, they showed that it was really beneficial. And so like New England Journal of Medicine like published this, and everyone was just going, wow, that's amazing. And people got really, it's like, hold on a second, this has never been reproduced. Like you should not have published this. Like this needs to be reproduced before you do this. And
For the
so
public.
New England Journal of Medicine was like, okay, well, all right, well, let's do that. And so another lab did this, and the guy from the original study said, well, look, I have to be involved, because there's a technique to this. There's a technique. You take one drop of this substance, you put it in like a 50-gallon barrel, and then you stir in a magic stir wand way. And then you take one drop of that, put in another 50-gallon barrel, and you do the same thing, and you keep going down, right? So there's nothing left, but it's the magic of the stirring that's what does it. That's what he was saying. And so
Sounds like my
they
grandfather's cornbread. My grandfather had to stir it. Sorry.
Oh yeah. And and so they were doing this, and they were finding like, okay, we're doing this experiment, and this guy had to be involved. And it's like, okay. And all of a sudden, the experiment was going in the direction that the first experiment was going in. But they started noticing some inconsistencies, and they sort of actually had a suspicion that he was actually going in and changing some of the data and changing some of the things like when people weren't in the lab.
Mm,
And so they locked him out. They changed all, the access to all these things. And and so the homeopathic guy now could only come in, stir the thing, and then he had to go away, right? And then all of a sudden it just went completely off the rails. It was absolutely not, better than placebo. There's nothing there, right?
yeah.
And so, 1 month later, the New England Journal of Medicine, wrote a retraction, said, "Hey, sorry, we shouldn't have published that. That was premature. It wasn't replicated. We tried to replicate it. It couldn't be replicated, so we're taking it off." But like everybody still like looks at that and goes, "Oh, look at this. Homeopathy works. It's in the New England Journal of Medicine." It's like, not really. And so it's really important to have that reproducibility. And
Yeah.
we don't even do that anymore. That was in my lifetime that happened with the New England Journal of Medicine. Like I remember that happening and being taught about that in school. And this was the taught to us as like, this is the importance of reproducibility. You have to reproduce something. Somebody else in an independent lab has to be able to reproduce it
Yeah.
before you should pay attention to it. Now that never happens. And in 93, that's what happened. There's an experiment. There was a test that Monsanto, I believe Monsanto, whomever, did at the time, looking at glyphosate. And this was the study that made it allowable to put this in the food supply, right? And you spray it on right before, it helped ripen it up, and then you harvest it. So it's right there. It's fresh as you're, at least still wet as you're harvesting this stuff, not really, but it's still on there, certainly. And so their experiment was with mice. So, okay, so it's not people, but it's mice. And they followed them for 3 months, and they were exposing them to amount of glyphosate. They said, look at this, there's no problems after 3 months, everything's great. But then with that information, they decided to put glyphosate into the food supply forever, not just for 3 months or 3 years, but for the entire life cycle of humanity, right? And so say, oh, this is okay, and
What could
dogs
go
and cats,
wrong?
because now it's in kibble. And so Dr. Senef, uh, you know, talks about how a colleague of hers that also researches glyphosate tried to reproduce this study. And again, it wasn't reproduced at the time. They just said, oh yeah, all great. So this guy reproduced it, and he took mice, he exposed them to the same amount of glyphosate, but instead of just stopping it at 3 months, he just extended it out through the entire lifespan of the mice. And he found that at about 4 months, the wheels started falling off, and they started getting
No
all
wonder
these.
they stopped at
Yeah.
3.
Well, that's it, because there's a lot of there's a lot of fraudulent studies, and one of those is by having retrospective endpoints. You run this experiment and go like, ooh, it's looking good up to here, but then it gets bad, so we'll just say we planned on stopping it here anyway, and here's your study. And so at 4 months, things started getting bad. They all were dying early. They're all getting like crazy tumors and organ damage and things like that. And so no, this stuff is not safe. And it's
Okay.
the point that I make all the time, is that slow poison is still poison. It doesn't have to kill you today to be a poison. It needs to cause harm years from now, and it's still a poison, and it's causing disruption and harm. And but yeah, now it's in there. And so even though it's been shown that no, this does cause harm, it's sort of hard to put the genie back in the bottle.
It is. I will say, I do advocate, like, there's nothing you can do about if your kid's going to have autism or not. I really don't think that at this point there's a whole lot that you can do. We've all been exposed to so much stuff. I think that it's going to be a crapshoot. You're going to roll the dice every time that you have a child. But there are things that you can do, I think, to minimize the risk. And I think starting them off properly and eating proper human diet. I'm part of Dr. Berry's community. I've got to use that term. So,
It's a good term.
Yeah. So proper human diet from the beginning, I think is important, which if that means breast milk, if that means you got to get a wet nurse, I mean, if you got to get a goat, to give it goat milk, whatever it takes. But just don't use the formulas and then start them off with meat. I think it's really important. And, both my kids are on ketogenic diets and it's helped them a lot. Anybody's watching, you can go find their stories, like Dave Mack's channel and Aaliyah's channel. Alia, everybody calls her Alia. I say Aaliyah, so it's the West Virginia in me.
Yeah.
But yeah, so that I think that's important too is diet. In treating these kids, I think that it can have a profound effect. I think was it you that talked about the study about was it carnitine?
Mhm.
Lack of carnitine
Yeah, from
in the brain?
Texas A&M. Yeah,
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 so
yeah,
it's in meat.
yeah.
Imagine
Only
that.
exclusively. Yeah,
Go figure.
yeah.
Sorry, I'm a little
Well,
snarky.
yeah. Well, the counter argument is, well, that doesn't matter because we make carnitine. Not everyone makes it. And not everyone necessarily makes enough of it. And so in
Yeah.
those, and so that's the thing, in medicine, you have a genetic predisposition and environmental trigger. And you have twin studies where you have sets of identical twins. And, one gets the disease, not the other one doesn't always get that disease, even if it's a genetic disease and it's called penetrance. And so this has a 60% penetrance. If you have that gene, there's a 60% chance you're actually going to express the phenotype for that disease or for
Yep.
that gene. So that's how that works. So if you have a genetic predisposition, i.e., you don't make enough carnitine and you're not getting it from your environment, so genetic predisposition, environmental
Mhm.
trigger,
Yep.
then you can have a misdevelopment of your neurons and your mitochondria and your brain, and this could cause problems. And so Texas A&M showed that this can cause a form of autism and it's misdevelopment of these neurons because of the lack of carnitine and the damaged mitochondria as a result. And so, that's the thing, if you have a genetic predisposition, but you don't get the environmental trigger, you don't get the disease. And if you just have the environmental trigger, but you don't have the genetic predisposition, you also don't get the disease. And that's how most of these issues work.
Yeah.
And yeah,
So, genes load the gun, but lifestyle pulls the trigger.
that's
Yeah.
it.
Yeah.
Yeah,
So I
definitely.
think that's true. It's interesting. Like everybody in my family has autoimmune diseases except my brother Matt. And it's weird. Like my mom do you know what inclusion body myositis is?
Um, I've I have actually, yeah, I have come across it before. It's not something I have much experience with though.
It's very rare.
Yeah.
And it's similar to polymyositis, but there's no treatment.
Mm.
And my mom had inclusion body myositis. And she slowly died from it. Eventually, she went on
Mm.
comfortable care. So, but it's like she had autoimmune issues. My dad had autoimmune issues. Me and my brother have them. And it's just like,
Mm.
what caused
Mm.
it? And where does that fall into the spectrum too? And is that what also kind of maybe helped prime my children for autism? Like, is there a study on that? How do we know? Is there a study on autoimmunity and autism?
I don't know. I haven't looked into it.
It'd be a good study.
Mhm.
It'd be a good
Yeah.
study.
Thinking about it, I think I've come across one person recently with inclusion body myositis who is actually getting some at least preliminary good results with a carnivore diet, which
I wish I
I
would have
think
known.
is well, it's great, but
It is great.
autoimmunity in general, I think that well, I know that every autoimmune issue that I've seen thus far responds very well
Responds
to
very
a
well.
carnivore diet, proper human diet, because I think it's addressing an underlying root cause mechanism that your
Mhm.
body that you're having these toxins that are getting in your body, they're attacking your body, and your body's doing what it's supposed to do, which is attack those things. And I don't think that it's your body's just screwed up and is attacking itself because it doesn't behave that way. It's not like you're if you have Hashimoto's, it's thinking your thyroid is just an abscess, and so it's just full court press, massive auto antibody sort of attack and all these sorts of things. it ebbs and flows. You get flare-ups
Mhm.
remission periods. And like, when would that ever happen with pneumonia? That happens when you die from pneumonia, right? Because if your immune system pulls back and just takes the weekend off, you're dead. That infection is just going to go crazy in your body, and you're dead. So that shouldn't happen. I mean,
Yeah.
if your body thinks your thyroid is an invading infection, it has to kill it ASAP, or else you're dead. And so the simple fact that people don't burn out their thyroid and it doesn't get
Because
dissolved and reabsorbed within a week or so tells me that this is not behaving in that your just body thinks it's an infection. It
hmm
doesn't behave like that. And then you have things like celiac that's gluten mediated autoimmunity. What the hell does that mean? Well, it means if you don't eat gluten, you don't get the auto antibody attack. So even though you have antibodies for celiac for up to 3 years after your last exposure to gluten, there's no attack on your body. And so you have to eat the gluten, and then that gluten actually attacks your enterocytes. And then those antibodies attack that complex, which damages your enterocytes because it's like civilian casualties. You
yeah,
napalm a forest, there's going to be other people there besides the Viet Cong, right?
yeah,
And so that's what's going on with celiac. And you remove gluten, and you can see this on microscope, in biopsy, that within 4 to 6 weeks the gut lining is completely healed,
healed.
even though those antibodies are still elevated for up to 3 years. And so that's not an autoimmune disease. Your body is not attacking itself, right?
Yeah.
It's attacking something else. And I think that's the rest of antibody or autoimmunity as well.
So you okay? So I have well, I want to hear your theory on
Mm,
autoimmunity, which is what Carrie said to ask about, and so I'm
mm,
glad you kind of went there.
mm,
But I also don't. I hate the way that autoimmunity is classified. I
mm.
don't believe that there's such a thing as Hashimoto's versus psoriasis versus lupus versus XYZ. I don't think that they need to be classified into separate entities. I think that they need to do what they did with autism and take all of the diagnosis and put it under an umbrella and say that um you have
Autoimmunity
autoimmune
spectrum
disorder.
disorder.
Yeah.
Yeah.
Yeah, because when does it stop? Like
Mm,
I was diagnosed with Sjogren's first, right? So that gave me primary Sjogren syndrome. Well, Sjogren's does not exist without another autoimmune as primary source ever. Like once you get once you get another one, it moves to secondary. It's never the primary. And I think that that's pretty interesting. So then which came first, the chicken or the egg, obviously. But then it's like, why? So why is it that people are like, oh, I don't have just one, I have four? Because it's a cascade. It's a cascade of an attack. It's like, oh, now I got to keep attacking something else. I got to it's something is still invading. It's not shutting off. The immune system is not shutting off. So it just continually tries to fight whatever it can. And I think that that's why you develop multiple ones. I don't think it's just like, oh, well, you have psoriasis and now you have scleroderma and now you have XYZ. Like,
Yeah, well, when you have an autoimmune condition, when you have one autoimmune condition, you often have multiple autoimmune
yeah,
conditions. And I think that plays right in with my idea of what autoimmunity is, which is like a celiac sort of thing, where it's not actually your body attacking itself, your body's attacking like in the case of celiac, the gluten. And gluten is a lectin, which is a plant toxin, which is protein with a carbohydrate substructure, and they can bind to all sorts of different antigens or molecules on the
yeah,
surface of our cells. So it binds to that, it damages them, it causes leaky gut and other sorts of issues.
mhm,
And then your body's doing exactly what it's supposed to do. Its immune system is doing exactly what it's designed to do, which is defend yourself and attack these attackers. But because the lectin is bound to
to one of our
the
proteins.
to one of your antigens on your cells, your cells are going to get hit in the crossfire because those antibodies are going to start attacking that thing that's on your cell, and you get damaged that way. But again, when you stop eating gluten,
Gluten, then it goes
your
away.
antibodies stay elevated for over three
3 years.
years. That's in the textbook. And yet no damage is occurring. to your gut, and your gut actually heals from this damage. Okay, so what about other lectins? Lectins are strongly associated with autoimmunity. Glyphosate is also heavily associated with it as well. They both cause leaky gut, and they both can get into your body and potentially attack things. Lectins certainly can. We know that they get all over the body and attack them, and they can track up the vagus nerve and go in the substantia nigra and damage that. And people that have had their vagus nerve cut are in study in Netherlands. They looked over like 20, 25 years of people who had had a vagotomy, and they found that they had a 66% reduction in Parkinson's in that population, right? So, and we know, we've seen and visualize with radiofluorescent labeled lectins that they can actually track up the vagus nerve and go into the substantia nigra and start damaging it. So, that's what these nasty plant chemicals do. They get in your body, they cause havoc, and we're expressing the downstream effect of this damage as diseases, right? But no, it's just we're getting toxic exposure. So, not to say that's the only cause of Parkinson's, but it sure is interesting, that happens and could be a contributory factor. But these lectins get in your body, and glyphosate can now get in your body because of the leaky gut. And okay, they stick to things, right? So they can probably stick to everything else. And so this is why I think that you have multiple autoimmune issues, if you have one at all, because they can get in. They're not just attacking your thyroid. They're attacking all sorts of different things, and then your body's responding to that attack, right? And so that's what I think is happening. When I was taking immunology, this is, postgraduate level immunology, when I was in my undergraduate degree before I went to medical school, that it was very clear that the body cannot attack itself. When your immune cells are maturing in your thymus, they're tested against every single antigen in your body, every single molecule that your DNA can possibly make. And if it reacted even weakly to any of those, they would kill it. And so there's no way your immune system, your mature immune cells, are incapable of making and expressing antibodies that can even weakly link up with your own antigens. And so this idea of molecular mimicry is impossible.
That's what I was going to pull up, because that is what's taught. That's what we were taught. It's a theory. I will say that in my book it says it's a theory that has not been proven.
It's not a theory by the immunologists. That is not a theory in my immunology textbook, right? Because it can't be, right? Because if your immune cells have the capacity to make an antibody towards a bacteria that could cross-react with one of your cells, it could just make an antibody that reacts with your cells in the first place, because these immune cells, they're constantly pumping out different antibodies in different variations, because they have the sort of the parts of the sort of a Y-shaped structure, a lot of these things. And there's certain active zones in that, and they change that active zone. So it's just constantly putting out just, random changes and seemingly random changes. And just pumping these things out there. And then if it reacts even weakly to something, it's just like, oh, okay, go get it. And that comes back and that sends a signal. And then they start upregulating the production of that antibody towards something else. And so, but, so they're pumping these things out constantly. If they could react to any of your antigens, they would, and your body would just attack that, right? You wouldn't need an infection to come in. You wouldn't need a precipitating event to then get molecular mimicry. You wouldn't need it if it had the capability of doing that in the first place, which it does not, unless something goes wrong in that maturation process. Then it would just do that anyway. So if there were a disruption of the maturation process, this is what you would see. You would see your body just attacking itself directly. You would not need a precipitating event to have molecular mimicry. It would have a full court press and massive increase in antibodies and immune response towards that antigen, which is your body, until it was dead. It would not have these ups and downs and ebbs and flows. It would not have to wait for a precipitating event. And if you changed your diet, it would not change one iota of what happened with that immune response. And yet that's exactly what we're seeing. So we're not seeing all the other things that would make this an infection, that would make it, if like your body responding to an infection. We are seeing what would happen, the results, like if we considered this an exposure and you remove that exposure like gluten, and this problem going away. That's exactly what we're seeing with celiac. It's a bit more, a bit easier
To
because
see.
gluten only goes through if you eat it, right? But then
Yeah.
eventually it goes out, right? Because it's a one-way tube. So when you stop eating gluten, the damage can heal and just get over because there's no more gluten there. But when you're eating lectins and toxins and glyphosates and things like that, and they get in through your leaky gut, they can stay in there for weeks or months. And so they can continue to damage parts of your body until your body clears this crap out. And so you can have ongoing autoimmunity, or additionally, if you're not really careful with what you're eating, you could be introducing more of these things. This is another reason why like a lion diet seems to work best for people with autoimmunity. It's just the ruminant animals, because
Yeah.
that ruminant process of fermentation breaks down these plant toxins
All the plant
and
toxin. Yeah.
glyphosate.
Yeah.
It breaks down glyphosate as well. And so when you're eating a ruminant animal, you're getting a much cleaner meat. Whereas if you're getting pork, chicken, and fish
Okay.
that are farmed and being fed, glyphosate ridden, plants that they're
Well, I
not
mean, even
designed
if
to
it's
eat.
wild caught fish, even if it's wild caught fish because
Mm,
it's running off into our
mm.
rivers and
Well, there's
oceans.
that too.
Well, I
Yeah.
mean, that's
And
insane. That's insane. Like it's
mm,
kind of a light bulb moment. So I have a follow-up question for
mm,
about that for you. So I want to get your take. Um, so there was a virus that came out in 2020 that if people got it, a lot of people are developing autoimmune afterwards. So what's your take on that then? Like so where does that fit in? Is it just because it's making the immune system go ape shit because it's a man-made virus? Or
it, or, what else is going on? If you have certain proteins that are being expressed and those are known to bind on, latch on, and damage, certain cell structures and cell lines, what is your immune system designed to do? Get rid of that crap.
yeah.
And so, and so if that thing is stuck onto an organ or a tissue, when the antibody comes to attack that, you can attack that complex, and you can get hit in the crossfires. It's civilian casualties, right?
Yeah.
So
Mm.
that's you're putting things in your body that aren't supposed to be there. Those can bind onto and damage your cells and your tissue, and your immune system is supposed to protect against that, and so it has to attack that. So if you have a bacteria or something else like that attacking your cells, binding onto them, trying to damage them, eat them, whatever,
Mm.
you're going to get immune cells going after them. So it's the same exact principle that these chemicals or whatever are in your body, they're attacking your body, and your body's trying to defend against it. It's just that you're getting hit in the crossfire. And if these
Interesting.
things don't go away, like let's say you did something to alter your genetic code and you're just constantly expressing these proteins, whatever they are, and you're
Mm.
constantly pumping out foreign proteins that your body is not happy with being there, and those things are going around sticking and damaging things. You're going to have a constant expression of this process that we call autoimmunity, which I don't think is autoimmunity. Now the thing there would be the exact same thing that you do in the context of if you were getting these chemicals in your body through the things that you were eating. You have to sort of eliminate those things. And so, if that were the case, is that going to make it more difficult for them to get rid of that if their body's expressing these proteins? Yes, it would be. The thought is that those cells would have to die before they stop expressing those proteins. So maybe there's some sort of mechanism for that. We don't really know. There are people that have, like Dr. Peter McCullough and others who've come up with protocols published in
Protocols
peer-reviewed sort of literature to sort of help
with that.
relieve that sort of thing.
Yeah, we need to
So
look
maybe.
into that because my husband's Army
Mhm.
and we were the first US Army base to roll out
Mm, that thingy.
that thing that we can't mention. So, yeah. So, and they were forced at that point. I was a volunteer.
Mm,
So,
yeah. Um,
So welcome to
Well,
the army. But
yeah.
yeah,
Well, and the other thing too is that, it could damage some process and allow these things to get in and make it because, the
make
thing
it
is that,
easier.
we still don't know why the hell any of this would start in the first place. Now we know that autoimmunity is getting higher and higher and higher and higher and higher. And there are other interesting things like people with it's people that get MS are usually in the more
Elevate
upper
higher
latitudes
elevation,
and things like
higher
and
elevations. Yeah.
yeah, and latitudes, right? And so, closer to the equator, there's much, much less. And there's a number of autoimmune diseases that the same thing. You get closer to the equator, and there's less of it there.
There's a lot of
Um,
there's a lot of MS from my hometown.
mm,
Because the town that I'm from in West Virginia is 3,000 feet elevation. So
mm,
while it's not Denver,
mm.
compared to the rest of the United States, it's pretty high. Um, so there's a lot of MS there because of
Yeah.
the elevation.
Yeah. Hey guys, just want to take a second to thank our sponsor at Carnivore Bar. I don't promote many products because honestly, all you need to be healthy is to just eat meat. For those times that you're out hiking, road tripping, or stuck at work and you want a nutritious snack that is just meat, fat, and salt if you want it, the Carnivore Bar is a great option. So I like this product not because it's just pure meat, but also because I want the carnivore market to thrive as well. And the more we support meat-only products, the more meat-only products there will be available in the mainstream. So if this sounds like something you'd like to get behind, check it out using my discount code Anthony to get 10% off, which also applies to subscriptions, giving you 25% off total. All right, thanks guys. Well, and the thing is that, why is it that, someone might get, MS or something else, um, eating one way, and other people eating that same way, may
Don't
not, living in the same area, having similar sort of exposures. We don't
and just
know
don't know.
exactly. There could be, again, some sort of genetic predisposition or something happening. But either way, I don't necessarily think that my theory is perfect because we don't necessarily know why it does it for some people and not other people. But in practical terms, it certainly seems to work and explain, the sort of the observed phenomenon that you remove these insults and these exposures and the problem goes away, even when the antibodies are elevated. And that's really important. And so when you have Hashimoto's patients with going on a strict carnivore diet, their antibodies do come down slowly, but it takes a year and a half, 2 years before that comes down to nothing. But their thyroid function starts improving right away, and that's important. And people with Crohn's disease, you're going to have these antibodies. They don't go away right away because if you have an infection and you have these expression of antibodies, yes, they'll come down a bit if there's no active infection, but it comes down very slowly. You generally remain pretty high on your titers for years before that comes down to a very low basal rate, but it never really goes away. It
Yeah.
needs to sort of be there in the background just in case that thing ever comes back. That's when you get lifelong immunity. And but so it can take years and years and years to come down. But people with Crohn's disease, within a month, they're improving massively,
Yeah.
and their body can heal. The gut heals very quickly, and this is like celiac disease. You stop eating this problem, the body starts to heal. MS, very different because it takes months and years for nervous tissue to heal. It's very
Yeah.
slow growing. And so, that's going to take longer. That's going to take 6 months, 8 months before you're seeing significant improvement in your neurological,
Your function.
your neurology. And you need all the other bits and pieces in place. Well, you need enough B12, optimal levels of B12. You need DHA, EPA, you need cholesterol, vitamin D, all these sorts of things. You need those to be optimal. And most people starting out
For
are
nerve.
not optimal. It
Yeah,
takes
for
months and
nerves.
months and months
Yeah.
to come up. Yeah. So, there's a lot of these things, but when you remove these things completely, the damage seems to stop anyway, even though the antibodies are still present and remain present for years, and the body starts to heal. And so, we're putting together a study, a case series on patients with multiple sclerosis that have recovered, and within 6 months. Some of them in a couple months, and we're like, okay, well, let's do like a sort of a minimum 6 months so you get some, you know, see what's happening at that point. One guy has been doing this for like, 7, 8 years. He had primary progressive multiple sclerosis. He had multiple lesions throughout his brain and his spinal cord. In his first presentation, he had a 5 centimeter lesion on his brain stem, and he was basically, going towards the, being crippled. And he just said, look, I'm a very bright guy, he's like, executive at a Fortune 500 company. He's like, listen, I go into companies that are failing and I figure out how to fix them. I can do this for myself too. And so he looked at it and said, okay, this is a problem of inflammation. I need to reduce inflammation. What does the brain need? What do the nerves need? How do they grow? And he did all those things, and he just came to it on his own. You needed meat, you needed fat, you needed all these sorts of nutrients. You needed to get away from, inflammatory foods and carbs and sugars and all that sort of stuff. He completely reversed his condition, and now he's in his 50s playing semi-professional volleyball, and he has no lesions. Like there's like a bit of scar tissue. That 5 centimeter lesion on his brainstem is now 1/8 of an inch, and it's a bit of scar tissue, right?
See, I can't. When is this case series going to come out? When?
This year, hopefully. Yeah.
Okay, good, because I want to read it.
Mm-hmm.
Yeah, because it's crazy the amount that we've seen. I think that's why I was so attracted to Healing Humanity and like
Mm-hmm.
and volunteering and getting involved in it. And it's sad I haven't been able to go to any of the meetups,
Mm-hmm.
and it's so like I've not met anybody in person, so it kind of sucks. But you're seeing all these people reverse things that we are taught that is completely unreversible. It's progressive, it's chronic, it's symptom management and hope for the best. And we're seeing CAC scores reverse,
Mm-hmm.
which is insanity. We're seeing heart failure reverse,
Mm-hmm.
autoimmune diseases reverse, neurological conditions reverse, Alzheimer's
Mm-hmm.
reversing. And it's like, this should be splattered all over the news.
Mm-hmm.
And it's
Yeah,
not.
they
It's
definitely.
and it's
Yeah.
sad.
Yeah.
And you guys, like recently, it just came across my news feed. It was this guy does a carnivore diet, and they brought on this doctor that was like, oh, this is not good because it's not
Mm.
balanced and blah 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 blah
Yeah,
blah.
it
And
doesn't have
who would
fiber. Like that's the
it
only
doesn't have
nutrient they ever
fiber.
said.
It
Oh, it
doesn't
doesn't even have
have
fiber. It
fiber.
was just like,
Yes. And then they pull
yeah.
out a play, and it was actually Dr. Westman that was doing a
Mm.
video, like like critiquing it. And he's like, they're like, pull it. What you need is this. This is a Mediterranean diet. And he looked at the plate. He's like, that's keto.
Hmm.
It's keto. Like,
Yeah.
yes, that's a
Yeah.
healthy diet right there.
Yeah.
Because I don't see processed food. I see
Hmm.
protein and greens. Okay.
Hmm.
Okay. Like,
Yeah.
it's like they're gagging at gnats and swallowing
Mhm.
camels.
Yeah. Well, I always, I always like point out too, Mediterranean's a big place, So what Mediterranean
Which
diet are we doing now? Are we doing the Spanish Mediterranean, the Italian, the Greek,
the Greek
maybe the Syrian or the Moroccan or the Egyptian or the
or
Algerian,
or
you know?
the Jew, even Jews are they have a very Mediterranean fish heavy like
Mhm.
diet. So yeah, I mean, it's a
Yeah.
big part of the map.
Yeah. Well, look, I mean, it's like that's what I'm saying. Yeah, it's like they're all over the place. It's just like, yeah, I do the Mediterranean diet. So it's like the cuisine of Algeria. It's like, oh, okay.
Well,
Like what
I knew
what is a Mediterranean? There is no one Mediterranean
Canadian
diet. It's
diet.
just
So
nonsense. I'm even going from Spain to the south of France, wildly different cuisines.
different. So this is a side note. If anybody out that is watching needs to talk to their doctor and wants to say that they can't say carnivore diet because they're going to flip their lid,
Mhm.
say I'm on a modified Mediterranean diet.
Yeah,
And that's it.
exactly.
And that's
Yeah.
it. And then they will praise you all day long.
Yeah, well, yeah, modified. I'm on a modified vegan diet. I only eat vegans. And
I
so
only
just
eat
all,
vegans.
yeah, that's it. And
Actually chicken. I eat chicken sometimes, occasionally, and
yeah,
they'll eat
well,
anything.
that's not vegan. Sorry,
I know,
that's
right?
disgusting. You make me
I know.
sick. You know.
Listen, my son eats. I didn't tell you what my kids eat. My son
Mm,
gets up and he's a cross country runner.
nice,
He eats a pound of bacon every morning.
nice.
He eats a modified PB and J for lunch, so it's egg white bread.
Mm,
and no sugar, plain peanut butter, and then no sugar, like fruit only
mm,
jam. And he's got texture issues, so it has to be only certain fruits. It
mm.
can't be anything else. And then he eats like 2 to 3 pounds of chicken thighs for dinner every
Nice.
day.
Nice.
That's what he eats. And he'll eat like pecans and cashews like as
Hmm.
a snack. But he's very like,
Yeah.
this is what I eat every day. That's his brand of autism. He's like, actually, the more I eat it, the more I love it. So it's
Hmm.
like, yeah.
Yeah. Yeah. And how have they done since you changed diet and things like that with them?
So Jacob's pretty interesting. So Jacob did not hit puberty right. He was 14 and still he was obese. He was only about 5 foot tall.
Hmm.
And okay, we're short people. So we're just little people anyway. I'm 5'2 3/4. My husband is 5'6 3/4. My son is now 5'9. So it did wonders for him. So he grew beyond our capacity. So he didn't hit puberty. He was 14. His voice hadn't started to change, not even a crack. And he only had secondary characteristics. He was like stuck in like Tanner stage like 3. And he was just like stuck there. And we started to get really worried, and I was like, "Jake, you've got to do something. You look like your uncle did at his age." And he didn't hit puberty right either. And he had to go on testosterone therapy and like all these things. So he cried and reluctantly said that he would. And he's got what is like a resistant eating disorder
Mm,
where it has to do with textures, and they will like gag and vomit
mm. Okay.
at textures. So we had to be very careful on how we proceeded.
Hmm.
And we finally found that he liked bacon, and he liked chicken, either chicken wings or chicken thighs. And, I had to figure out a modified PB&J because he wasn't giving that shit up. And so, and so that's what I did. And within it was 5 months, he had shot up. He had like fully hit puberty. He had lost weight. He was running cross country and doing well. And it was pretty astounding actually, like seeing what he went through. Now his autism is less severe um socially, but emotionally he had more of the like his emotional intelligence was not very good. So that improved dramatically, and he was able to make friends and be more sociable and join a team. It was really cool. You can Anybody wants to watch his interview like with Alia, it's on her channel, and it's just it's pretty interesting listening to him talk about it, because I was just like out of the picture. I was like, you just talk about what you want to talk about and let him go. And he was like, it's magic. It was magic. So okay, it was magic, whatever. But it's not magic, it's science.
Hmm.
But with Audrey, so her ADHD is really good. So she has comorbid autism, ADHD, and obsessive compulsive disorder. So my husband has legit OCD called scrupulosity, and he is also on like modified carnivore. He'll still eat like a few vegetables, like he does, like, or fruits, I guess, because he loves olives. um so there's some things he still eats, and it did not do anything for his OCD. It Don't know why. um
Hmm.
but so she got that from him, and her ADHD is much better. She sits down and she can focus and do her schoolwork, and that has been huge, for her. Um, Still working on her OCD. Her autism, it didn't change her autism. Um, so I mean, I guess maybe a little. Her emotional intelligence has gotten better.
Yeah.
But she's still awkward. She's just that awkward girl that's
Mm.
she's she's very different. She's very smart. She's got
Mm.
she's got a vocabulary that beats out most college
Nice.
kids.
Yeah.
Yeah. So that's
You
one of
know,
her specialties.
I mean, everyone goes through awkward phases as well, and just through adolescence, and so that's certainly, not, not necessarily something she can't, grow out of and work
Yeah.
on.
I
Have
always
they
say
ever
she's about a
been,
decade behind.
yeah, well, and as long as she's, still
She's
moving,
progressing. Yeah.
yeah. And have you guys ever been like, been able to get them to a point where they're really at least ketogenic in their approach?
They are like Jacob's almost always in
Yeah.
ketosis when I've stuck
Okay.
him.
Yeah,
And
even
then
with the
Audrey,
fruit sort of stuff.
even with the fruit, it's pretty
Yeah.
well because we did it for so long without fruit
Hmm.
that I didn't let him
Okay.
add it back. So he's pretty flexible now. He can go in and out of ketosis.
Hmm.
A lot of people call that metabolic flexibility. I don't know if that's really a thing or I don't know. It's a theory that I'm not 100% sold on
Hmm.
yet. But um Audrey almost always is, unless
Okay.
she sneaks something. She is an emotional eater, so I have to be very careful. And she will
Hmm.
slam a whole block of cheese if I let her. And I
Yeah.
have to
Right.
be, and
Yeah.
I have to be very careful. Cheese in our family just doesn't go very well. So,
Hmm.
cheese
Yeah.
I found is very evil. It's very
Yeah.
evil for my
Like,
thyroid. Like I will eat
yeah.
cheese, and it'll be Parmesan. It'll be good stuff.
Yeah.
And the next day, my thyroid is like, I'm like, I can't swallow. And I can't feel
Yeah.
it. Well, and I'm a singer. So
Mm.
it's like that was my first degree. I have a
Mm.
bachelor's of fine arts. I have a piece of paper that says I can sing on stage and promote myself. And I know it's funny. And then I went into medicine, but it's like um then I can't sing. Like when it swells, you can't hardly sing. It presses so hard on the vocal cords. Well, on the voice box, but tangentially, you know.
Yeah. Yeah.
So yeah,
Yeah.
so
Well,
no cheese for me.
yeah. But I mean, that's a common trigger for autoimmunity. And
Why? Why does
mm,
it have to be cheese?
I know. Yeah. I think, the casein can be a bit pro-inflammatory. It
Mhm.
can, lead to leaky gut as well. If you already have leaky gut, then,
Yeah, yeah.
it'll cause problems as well. And, there could be more to this too. If you're causing leaky gut, it could be that there's different bacteria and things like that that are also getting in, and that's contributing to it as well. And so even if you're not eating plant toxins that can do this, something else may be getting in
Mhm.
that could be contributing to it as well. So, it's just,
Possible.
yeah, those sorts of things. But what people notice is that if you as strictly as you can,
Yep.
red meat and water, ruminant meat and water seems to do the best for autoimmunity. And so for whatever reason that is, it does seem to be the case, and that's what people have the best results on.
I feel the best when I eat like I my diet consists daily of beef. I do still eat butter and I eat eggs. And now I will occasionally eat chicken. Um and I do still have some seasonings. I have to be very picky and choosy. I can't do nightshades. Um, but yeah, so I'm pretty strict when it comes to the meats that I eat. I can't do pork. I can do bacon, but I can't do pork belly. It's really strange.
Interesting. What?
Yeah.
Like that's,
I,
yeah, it's the same
it
cut.
makes
And then they've
it
added
makes
more to it with the bacon. Yeah.
it makes absolutely no sense, but I
Mm.
can do bacon, but I can't do pork belly. Every time I
Oh,
eat pork
weird.
belly, I get sick to my stomach.
Oh,
I
very
also
odd.
can't do yogurt either.
Yeah.
Not
Okay.
even the yogurt that I make. Like I've
Mm.
made the El Rooterai.
Hmm.
Nope.
Hmm. Hmm. Okay.
Nope. There's none of that.
Yeah. All right. Well, so so what do you do as well with your work with Healing Humanity and those guys?
So it started like on the production team. So I
Mhm.
basically they tell me what to do. I'm the
Mhm.
assistant. So they tell me what to do and I go do it.
Mhm.
Um I did some interviews like when people were interviewing to be in the documentary. They would schedule interviews and it would be with me and I would just sit and talk to them like we're talking and they would tell their story and then that video would go to the people who made decisions and like that's how I did that, which is how I got comfortable in front of a camera, interestingly enough. So it's like the
And
more
so
you
how,
do it.
yeah, yeah, definitely. And how's the project coming along? When can we expect to see a sneak
Oh,
peek?
I wish I knew. I
Mhm.
wish I knew. I'm part of the core team and I wish
Mhm.
that I knew.
Mhm.
So we've still got some people that we're doing some B-roll footage for. So that part of that is scheduled for April in Tennessee. And I think there's somebody else in June that they're going to be going. So we're hoping sometime the fall, but again, I don't know. I don't do
Yeah.
the funding part. I don't
Mhm.
do like the production and like how long it takes to edit and all that stuff. So I'm not party to that. There's a good community over at healinghumanity.life though, if people want to get in there and just be a
Yeah.
part of a really good community. I mean, there's a lot of great communities out there. Um, because Dr. Barry's got his community, Healing Humanity has one. I think you have one. I get your newsletter. Um, so, everybody's got some great communities. I think people need to definitely join them.
You can definitely give a lot of support. And obviously there's having that sort of community aspect is sort of nice because a lot of times people are feeling very ostracized in their own personal life. Their family's against them, their doctors are against them, everyone around them thinks they're crazy. And if you're very strong-willed and you know that you're on the right path and you feel better, you can weather that. And but it's not always easy.
Yeah.
And uh, I, uh, I just see people do a lot better when they have people around them that can sort of make them feel like a little less weird. And even like that, you don't have to pay for that. If you're learning, you don't know how to do it. There's so many free resources out there. But if
Yeah.
you need more hand holding, there are places that you can do that. But as far
Yeah.
as the community is concerned, there's a lot of great ones that
Hmm.
incorporate both of those. But then there's also free ones. There's so many Facebook groups that are free, and you just have
Just
you
be
have other
careful.
people. Yeah, well, I was going to say that too. There some are weird, and some are not good, and some
You
are
got the keto
toxic.
police. You got the
Well, there's that.
keto and the carnivore police, you know.
Yeah,
And I'm like,
yeah.
guys, I think that we need as a community something that I'm very anti-dogmatic because
Mhm.
you go out and you tell people, well, I eat only meat and you should do that too. The people are going to be like flipping you off. I was going to just flip. I'm going to be nice and not do that.
Mhm.
And it's like we have to get people to slowly transition. I think is more like let's introduce them to the dark side before we pull back the curtain and say, hey, you really should only be eating, um, beef, salt, and water, because it's not realistic for 100% of everybody. And I think that people are more likely to change if you're like, how about we just start by removing processed foods and sugars and grains?
Yeah,
And
eat more meat. Don't be afraid of the
yeah,
fat.
yeah, and then
Yeah.
eventually, then be like, and then let's talk about like what it is. How did that food make you feel? Which is it brings me to my book. Did I told you I have a workbook.
Oh, there you go.
Yeah, so I did a workbook, and there's like a comprehensive. I'm a nurse, and with an autoimmune disease, so I built a symptom tracker, two
Mm.
pages. So it's 2 pages of medical symptoms and autoimmune symptoms and you could track it and be like, oh, this food did this to me. This and like, oh, well, maybe we should take that out and see how that goes for a week. Oh, well, and then you added it back in and your symptoms came back. Well, maybe, you shouldn't have that. Like I had to rip the band-aid off because I'm not a moderator. I'm an abstainer.
Mhm.
And
Yeah,
but there are people that they can't rip the band-aid off. Like,
yeah, yeah. And so yeah, so it's good to have different avenues for people to go down, depending on what works best for them as far as what they want to do. A lot of people don't necessarily want to change their life, even if it means
I think
remaining
that's
sick. And other people want to do it, but they can't quite get their head around doing it just all in one go. So there's always different ways of doing it.
I think that's the thing
Yeah.
that hurts my heart the most is people that are sick and they won't
Yeah, me
change.
too. That's difficult, when look, this can help you, and they're just like not interested. Um,
I'll
thankfully in
just
my
take my
practice,
insulin.
yeah, thankfully in my practice, it's a bit more specialized because I get people that are, it's not like a family medicine practice where I'm just seeing people come in, oh, I just want a this or that. I'm seeing people who have not had good success and results with the medical system, and they're tired of it. They want good results. They are well intentioned and and highly motivated, and the traditional treatments and recommendations have failed them. And they're
Yeah.
like, look, I've eaten less, I've moved more, I've done this, I've done that. It's just like none of it's working, and I'm getting worse and worse and worse, and on more and more medications. This can't this there has to be something else. And so then, they're highly motivated to actually do something else. It's like, okay, well, look, this is why this is wrong. Look at your blood work. This is why this is the way it is. You change the way you eat, you change your lifestyle in this ways, you should get these results
Hmm.
in how you feel and how you look and how your blood results come out. And you can make a strong case for that, and they're highly motivated people. So
Hmm.
it's the vast majority. I mean, it's nearly 100%. I can at least get to try it.
Yeah.
98% will stay on it. Some will go, okay, well, maybe like a modified ketogenic sort of approach, but I sort of need a bit more variety. And a couple of those people came back to me within a month and said, yeah, I need to go back to just strict carnivore because I was just feeling so much better. I didn't even realize how much better I was feeling without the salads. And then they come back in and it's just like, yeah, no, I got to get rid of these stupid things because I just feel so much better. And I'm the same way. I want to give people the information that they need to. They don't need me. They don't, unless something happens and there's a problem, which is what
Hmm.
medicine's supposed to be,
Yeah.
that they're just healthy and they have the skills to remain healthy and the knowledge to remain healthy. And then if there's a problem, there's an accident and they need surgery or some sort of emergency care, then there's the hospital system. And that's great. It's amazing that we can do that for people. And that's really interesting medicine. That's what I got into medicine for, is that real life and death sort of stuff. But now it's 90+% of the issues we treat are these chronic debilitating issues. Even in surgical specialties, you're dealing with cancers, you're dealing with degenerative spines and joints and things like that you have to fuse or replace, or do some other sort of surgical alteration for. So that's not how it used to be. It used to be you had an injury and then, you needed some sort of surgery or something like that. So
Yeah.
I really want to get it back to that. I want to get it back to just the accidents and emergencies being, the main issues that people have to deal with, and the
And
chronic diseases
births.
just go away. Yeah.
And birth.
Hmm.
And birth.
Hmm.
I think that, midwives.
Yeah, 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 yeah. And all
Yeah.
all the things that aren't chronic disease related, that I mean, that was what we did. It was pregnancy and childbirth, congenital and genetic issues, infectious disease, injuries, and like poisoning exposures, toxicities, getting snake bite, or eating
Yeah.
something, like some sort of poison ivy or something like that. Now it's all chronic diseases, but really that sixth, and then malnutrition, all that sort of stuff. And but now it's really this chronic disease stuff, right?
Yeah.
But that's really just you know toxic exposure, poisoning, and malnutrition combined. Now it's just exploded, and that's
Exploded. Yeah.
90% of what we treat. We need to get back down to like this tiny little subset of the issues we treat, and then just people get on with their lives and just be healthy. Can you imagine the tens of trillions of dollars that
Dollars.
just would flood back into society,
Society.
and like the
The
directions that
education
could take
system.
us?
Like the education system. Like the amount of
Mhm.
money that we spend on sick care. I think that
Yeah.
I can't remember what the figure was, but the amount of money spent on diabetic medications
Mhm.
yearly just grows exponentially. I think it was like 70 billion, or it
Oh,
might
it's
be.
probably more than that. In America, it accounts for like 75% of the Medicare Medicaid budgets, or more now. It's
And it's
insane.
reversible.
Yeah, or completely preventable. It doesn't need to exist. Type 2 diabetes, that is.
Yeah, type 2. Yes.
And yeah,
It's
and
it's
yeah.
insane.
No, it is absolutely insane. I mean, all these things are. And so, I mean, so it's really good to have, more people that have seen this and now, going in and going further in their careers to be a nurse practitioner and provider and can actually start doing real medicine and getting people actually healthy so that, yeah, we can sort of get out of this, and get us back to what medicine used to be.
I want to not have a job. I
Hmm.
want there to not be
Yeah.
a reason for me to be around as a job. And then it'll force me to go into trauma medicine. Although I
Mm,
really have no, I
yeah.
have no desire for trauma medicine. Nada.
Yeah. Yeah, I really like surgery and trauma stuff. But that's what, thinking is like, okay, so what should I focus on? Like, if we can get rid of this chronic side of things, I mean, realistically, and from the span of my career, it's probably going to be enough, collateral damage. There's still going to be a lot of, degenerative spines and
Hmm.
cancers and things like that down the road. There's going to be, unfortunately, plenty of work for everybody, but hopefully we can get this down in the next 10, 20 years that that chronic buildup and damage doesn't happen for the next generation on. And that's what I would like. I would like to just and so I think about, okay, well, what am I going to do? If I win, I need to think of something else. Like, okay, well, let's focus on the trauma side of things, and just actually be there for people when there's an accident, which is what I like to do. So,
Yeah.
um,
Do you think you'll ever come back to the United States to
yeah, definitely,
practice?
100%. Yeah, absolutely. I just don't know when yet. It's just with all life and family and things like that. Just have to figure. But yeah, that's definitely the plan
The
for
goal.
sure. Yeah. Well, Becca, thank you so much for taking the time out. It was a really fun conversation, and hopefully everyone got a lot out of that. Where can people find you and support you and get your book?
My book's on Amazon, so it's self-published on Amazon. There's two. So because it's really expensive if I would have put it all together. So
Mm-hmm.
the and nobody's going to pay $50 for that. So the ketogenic workbook, it has a basically starting out. So if you're a beginner doing keto, or if you're switching from keto to carnivore, um, it's basically there's a 1 month planner in here, plus like what to eat and what not to eat, and symptom trackers and food planners and everything that you need to kind of get you going in the right track. And then there's a 3 month planner that you can get. Like if you're like, oh, I really like that organizational tool, like how I laid everything out. And you can get a 3 month planner also. So that's on Amazon. And it's Rebekah Bavry, Rebekahbavry. And you'll find me. Um, On YouTube, you also just put in my name and you'll find me. For some reason, put in Rebekah Barry, Barry. It also brings me up. Not quite sure how that happened.
Mm.
Very strange, but it is
Mm.
there. And I have a Facebook under Keeping It Keto. That's my company name. And my website is whatisketo.com. I don't know how I scored that one, but yay.
Cool. All right.
And
Well,
I
we'll
can
put
send you
those.
all the links and you can put in
Yeah,
whatever you want.
please do. Yeah, if you send those to me, I'll make sure that they get in the description so people hopefully be able to see them down below.
Yeah.
Okay. All right, Becca, thank you so much for coming on. It's been a pleasure
Yeah.
to talk to you and to get to meet you more personally, face to face.
Yeah. Thank you.
Thank you. Hey guys, thank you very much for taking the time out to listen to what I had to say. If you like it, then please like and subscribe to my YouTube channel and podcast. And if you're on YouTube, then please hit that little bell and subscribe, and that'll let you know anytime I have a new video out, which should be every week, if not more. And if you could share this with your friends, that would help me get the word out and let me know that you like what I'm doing. Thanks again, guys.